Hello and welcome to this episode of Healing Our Communities. I'm your host, Dr. Susan Margaret Murphy, president of the West Virginia Drug Intervention Institute. And today's guest is no stranger to prevention and healing his communities. And so I'm pleased to have with us today Evan Young, who is the director of Kanawha Communities That Care. Welcome, Evan.
Thank you, Dr. Murphy. It's a privilege to be here.
We're really excited to have you here. And so you've taken on a new role with Kanawha Communities That Care, which is a prevention coalition here in Kanawha County. We'll talk a little bit more about that and what that means here in a moment. But I'd like to start out with some questions that will help our viewers get to know you a little bit better. And so let's start with you just telling us a little bit about you and what brought you to community coalition work.
Well, thank you for that opportunity. And it's kind of a loaded question because there is a lot that does lead someone into this line of work. Mm-hmm. And I first like to say I was born and raised in Putnam County, West Virginia. All but a short period of time as an adolescent where I lived in Fort Wayne, Indiana. There my parents worked in the nonprofit sector, and my mom had a background in social work, and when we were living there, she became the director of a Boys and Girls Club in the urban area of the city where we lived. So in that opportunity, I got to experience what it was like to be the minority demographic for a change, and just benefit from the enrichment that can happen in a positive after-school program with friendly mentors, just introducing us to healthy activities and just enjoying arts and music and stuff like that together. And my dad also, he was an avid communicator and a connector, and he would call fundraising friend raising. So he knew no strangers in the community. So I really enjoyed just learning from my parents and seeing the lives they led and their focus on community betterment and how they poured that into us as young people. It kind of prompted us and prepared us to have compassion for other people and to just strive to understand and want to serve our community better. So.
That's fantastic. I think a lot of people that come to this work have some experience with after-school programming. Mm-hmm. So we talked to our education director our last episode, and she had worked in after-school programs as well. So it's kind of a natural transition into this work. Mm-hmm. And certainly your childhood really influenced that. So, so for viewers who may not know, what is a community prevention coalition?
Well, it's really a collaborative group of 12 key sectors, including, first and foremost, youth, parents, schools, and of course, key sectors including law enforcement, first responders, other government agencies and youth-serving organizations. And again, it's a collaborative culture centered around our top priorities as a coalition, which they're drug prevention, first and foremost, and right now we're focused on 3 problem statements or 3 key issues in the community, including opioids and, of course, the dangers of fentanyl and fake pills, and the ongoing underage drinking, and nicotine, vaping, and THC use, and all the different mechanisms that's being introduced into young people.
Yeah, and that's really what you're focusing on now in Kanawha County. Mm-hmm. But you had worked with the Putnam Coalition before coming to Kanawha County. What kinds of things did you do with the Putnam Coalition?
Yes, ma'am. Well, I began as a volunteer and an action advocate back in 2016. And again, they were centered in similar situations. It was early on in the opioid epidemic, the SUD crisis that we've encountered here in our state for almost a decade now. And I had seen that affect my own family, in my extended family, whether it was, addiction to opioids or substance use disorder, and even just other chronic disease like heart disease, obesity, and other ailments that I knew stemmed from more rooted issues in mental health or adverse childhood experiences or different traumas that people encounter. So it was just great to get together with a group of people that was coming together around these issues and collaborating on them.
How do you feel that your previous work experience prepared you to take over the Kanawha County Coalition?
Well, as I mentioned, I became a volunteer in 2016 just out of the genuine nature to help in our communities. And then it stemmed into an opportunity to join the staff in 2019 for Putnam Wellness Coalition. Unfortunately, that opportunity opened up when I lost our mentor, Bill O'Dell, who was just a shining light in our community and a leader just in the fight, you know. But he had kind of taken me under his wing and mentored me and everything I needed to know to be a contributor to the coalition. But prior to that, I had actually worked in corporate retail for almost a decade, and I had a successful career there. I learned from 5-star leaders in that arena. I learned a lot about leadership development, team management, sales, and stuff like that. So for me, that helped set me up for success to be the antagonist role in the fight against drugs, or, you know, that might be archaic language, the war on drugs, because we know it's very different now than how it might have been portrayed in the past. But we've learned that we've got to be better salespeople than these other people, whether it be in the streets or other entities that have perpetuated some of this vicious cycle.
Yeah, that's a really good point about translatable skills. And it's so interesting that you mentioned Bill O'Dell, because as I travel to work each day from Huntington to Charleston, often when I pass into Putnam County, he's one of the first thoughts in my mind. He was a huge advocate for prevention education and is very missed in our community. So fantastic that you had the opportunity to have him mentor you.
Yes, it was.
That's awesome. Talk a little bit about people that might want to get involved with this work, you know, as a profession. What advice would you have for them? You know, we have a lot of students graduating with, you know, public health degrees, communication degrees, you know, a lot of folks that are new prevention specialists or peer recovery support specialists. So what advice do you have for them?
Well, that's interesting. And first, I would just say, it might sound cliche, but just follow your heart. You know, you set a trajectory on what might be your priorities in your life, and you just start pursuing them step by step every day. It sometimes is a grassroots effort when you come together with people to collaborate, just meeting people, making meaningful connections in the community. All that stuff matters. And it's not so much that you need to guard your reputation. It's okay to be vulnerable. It's okay to talk about your personal flaws or traumas, or even if you are in active addiction or recovery, it's okay to just be open about the process. And we don't have to put on the facade that you see in the face of corporate America sometimes. It's okay to just be open, be yourself, find healing along your own journey, and finding a career in the field. So I'm not sure if I explained it well, but it's just kind of all-encompassing of all your gifts, talents, abilities. Your past experiences could be something that you could project positively back into young people. They could learn from what you've been through. So again, just be real, be open. It's sometimes misunderstood in the professional setting, but it is a very awesome professional opportunity as well.
I agree. Talk a little bit about the prevention programming and why that's important to youth. Why is prevention programming so important to youth?
Well, we know that the dangers of substance use is just occurring at an earlier and earlier age. And I just saw a statistic at the Prevention Summit at the Charleston Coliseum that the use increases by 10% every 2 years between age 12 and 25.
Yes.
So by age 12, more than 90% of youth had not yet used substances, whether it be alcohol, marijuana, nicotine, or opioids. But that quickly fell off 10% every other year. So it's just one of those things where, as I mentioned, your personal experience could be the story that someone needs to hear.
Yeah.
It could be the light in a dark time in their life where they need to, just need a little grace and need a little glimmer of hope. But we also incorporate evidence-based approaches, proven prevention science to help lead the charge. And I personally love to highlight healthy alternative activities.
Sure.
So as much as we might sometimes anti this, we want to promote the positive and help them create pathways to peace and joy in their own lives.
I think that's really important too, because what I've found in this work is we talk a lot about adverse childhood experiences, and my bias has been that we don't focus enough on positive childhood experiences that
Correct.
can combat those. And so that's one of the reasons, the Institute is happy to be the fiscal agent for Kanawha Communities That Care. We sponsor West Virginia Public Broadcasting's Writers Contest because, those alternative activities are not always sports. Sometimes it's art, sometimes it's writing. It's something that kids are passionate about, and finding that and lighting that fire is so key. So I'm going to veer off our script a little bit for a minute, and I don't think it will surprise you because before we started, we were talking about kids, and you and your wife, Brooke, have 4 daughters.
Yes.
And I'll share just a little bit of a personal story because I also have, Joe and I have 6 kids between us, and my youngest daughter had participated in a documentary on challenges that youth were facing that we did with PBS. And we had a screening. And afterwards, she was part of the panel. And she went up and she said, I don't know how to use naloxone. And, me as the mom on stage, I, was going like this. This kid doesn't know how to use naloxone. This is my work. But now she is a freshman at Marshall, and she is volunteering with an organization there that distributes naloxone and fentanyl test strips. So it's kind of come full circle because I got this message from her the other day that said, Mom, this is so cool. They got all this stuff from you.
That's great.
So I was really excited about that. So I'm interested to know how your kids have responded to the work that you do.
Well, it's pretty wonderful that, that's, as I mentioned, I left a very successful career in corporate retail. It was more lucrative as well, financially.
Sure.
Yet, my health was negating in that arena. I was almost 80 pounds heavier than what I am today, and I was heavy with a lot of baggage and a lot of ego infiltrated everything I did. And my kids, they get to see the real, genuine me. They get to see us make connections in the community, not by the reputation that my family's name might have had or whatever in our past, but they just get to see us step out, take risks, take on challenges, and create a new pathway, of positivity in our community. We started in 2016 a stand-up paddleboarding business, Appalachia Boarding Company, with a mission to help West Virginia regain balance, and that's just been a part of our kids' life.
Yeah.
And they get to help us teach stand-up paddleboarding to other youth at summer camps like Camp Appalachia, who serves youth in foster care, kids immediately affected by the SUD crisis.
Yeah.
So it's empowered my kids to make a difference and connect other kids to these key resources that some thought paddleboarding was something only the rich kids could do. And that's a quote we've got at camp. And it's just been second nature for them. So for me, that's been so rewarding as a parent to have them by my side. And they've, this past year, my oldest daughter, Sophia, got to attend the CADCA National Forum at Washington, D.C. and meet with key stakeholders, senators and delegates, and be along for the ride for that and just witness what could happen on a policy level and state and federal level, and it was a proud moment, not just me as a dad, not just because of me or about me, but just about them, and that they've had these incredible opportunities for capacity building and to increase their acumen as young individuals and change agents.
That's fantastic, and I've seen in some way all 6 of our kids dip a toe in this work as a result of watching the work that Joe and I do. So that's very rewarding as a parent. And it's also just kind of cool to see them light up and get it. And you and Brooke are helpers raising helpers, which I think is super cool. So it's awesome. That's fantastic. Well, we're talking to Evan Young, who is the director of Kanawha Communities That Care, the Prevention Coalition for Kanawha County. We're going to take a short break, and we'll be right back in a moment. At the Drug Intervention Institute, we are really excited about this new initiative called the Healthy Brain. The Healthy Brain is an inflatable brain
that kids can walk through and learn about how the brain works, how to keep their brain healthy, how medication works in the brain, and how addiction impacts the brain. This is an important prevention tool because it can teach kids how to make healthy choices. And so it's geared toward kindergarten through 5th graders, and we're hoping to target all of the kids in the southern part of the state. There are age-appropriate take-home activities for the children, but there's also a lesson plan, also age-appropriate, that teachers can take back and reinforce the things that they learned through the Healthy Brain experience in the classroom after visiting the exhibit. Our hope is to find semi-permanent locations in the southeastern part of the state where children already visit for field trips or experiential activities, and so that this can be an added benefit to those locations, and it can add and enhance the programming that they're already offering to those youth. To be a partner with us or to request the brain for a specific period of time in your semi-permanent location, you can contact us at the Institute by emailing me, susan@wvdii.org, or calling 681-205-2287. With your support, we can make a huge impact to the children of southeastern West Virginia and teach them the importance of keeping their minds healthy.
Hi, welcome back to this episode of Healing Our Communities. I'm Dr. Susan Margaret Murphy, president of the West Virginia Drug Intervention Institute and your host. And I'm here with Evan Young, who is the director of Kanawha Communities That Care. So earlier we were talking more about how you came to this work. What I'd like to kind of unpack during the second half is the work of the coalition and what you have planned for the coming years. So especially this year, because this is a new role for you, even though you came from Putnam County. And so you're really trying to reinvigorate the coalition. And so talk about where you see the coalition moving in the coming months.
Well, we have had a great start. Just in the past few months, we've gotten right into capacity building, and that's key, just to build a strong foundation for the coalition. We've done training centered around trauma-informed care, and that's been alongside law enforcement and first responders, and that's one of the key sectors we want to include at the table. And that was an awesome opportunity. I also did an implicit bias training with my cohort from Mountaineer Montessori School, and that was highly valuable just in acquiring an even higher level of cultural competence and just examining what implicit biases might be perpetuated throughout just our own society or just ourselves that we may have a blind spot to. So again, just examining also outlying areas in the community that might be underserved. So we had our first coalition meeting just in October to regather with everyone. And that was one of the first things we asked about was what are some of the gaps in services and what are some of the hot spots or underserved areas as well. So we got some valuable feedback, and we've learned about school closings and mergers that are about to occur in Kanawha County. So we want to be there to help support the teachers, the youth, and parents in that transition. So I'm most excited usually to work with our youth because there's such a great opportunity there, and we need youth at the table. So I would say the most important thing in the first year would also be just reestablishing a youth advisory council in Kanawha County. And that's just to bring together youth and empower them and equip them to use their voices to impact their peers and their schools and their social circles.
So when you do the work of the coalition, what kinds of programs does the coalition support in the schools and in the community?
Well, again, we mentioned some evidence-based programs that we have, and one of my favorites also is just a Healthy Alternatives Initiative. And again, we mentioned earlier just about adverse childhood experiences and helping educate youth on the underlying mental health issues or root causes of substance use. I think reducing stigma is
Yes.
huge also, so anti-stigma training, just so they can learn just the language of reverence and have that internal dialogue for self-love and self-care as well, and to understand the traumas they may be currently walking through. I think that's huge, first and foremost, also, that we understand that it's not, an attack on the person. It could be just traumas from their past that's leading them into certain decision making. And we'll collaborate with other entities and youth-serving organizations like the SAD clubs,
Yes.
which are Students Against Destructive Decisions, which is not always substances. It could be
Yes.
an overuse of screen time, other unhealthy choices or toxic relationships and stuff like that also. So again, it's kind of a whole continuum of care that we need to focus on.
And we've been very fortunate at the Institute that we've had a longstanding relationship with the Coalition as well as Kanawha County Schools. In fact, our Don't Keep Rex Around medication safety program was birthed in Kanawha County.
Yes.
And so the opportunity to participate in delivering that program and continue that program in Kanawha County Schools is really important to us. And we do that with support of the Coalition. And we also are excited to work with you on the Creative and Healthy Brain
Yes.
and try to get some of that programming out into Kanawha County. So we have a lot of work to do together over the next year as well. So talk to our viewers a little bit about the relationship with the Coalition and the Institute and the importance of that.
I'm thrilled to just be connected to such a diverse and creative team.
They're pretty
here
great.
at the Institute. Yes, and especially in our capital seat in Kanawha, it's such an incredible opportunity, and to reach so many diverse people groups. And the Drug Intervention Institute has shown great success over the past 4 years, just an exponential amount of growth to the national level, yet it's still rooted in our communities here at home. So I'm so excited just to team up with the expertise that we have in delivering vital trainings too, like naloxone training and how to administer the fentanyl test strips and other stuff like that. But I'm glad you mentioned Rex and the Healthy Brain, because those are so interactive and so engaging for young people.
Yes.
Just to be able to see it, hear it, touch it, and have a positive character to engage with and look up to. And so, I applaud DII, you and your team, Dr. Murphy, for just the great work you've done and seeing the need for beginning prevention at an earlier age. Again, just at the Prevention Summit today, they're just talking about such a great need to go even further upstream into the younger ages for prevention.
Yeah, and I think, part of the statistics you heard today when you were there earlier also are indicative of what we're seeing with the fentanyl crisis. So if you look at the population age 15 to 24, we're seeing, even though we're seeing nationwide a small decrease in overdoses, that particular age group we're seeing an increase. And a lot of that has to do with those counterfeit pills. Kids are taking Adderall that they think is a prescription medication, and it's a counterfeit pill, and then it's an accidental poisoning, really. And they overdose, and so that's unfortunate. And I know we both know of youth that we've lost in our circles to those types of circumstances. So I think the work that you're doing with the Coalition is just so important. If I'm someone in Kanawha County and I'm listening today, can I be a member of the Coalition? How do I become a member of the Coalition? How does that happen? Can I just say I want to be involved and I'm involved?
Absolutely. And you can reach out to me directly at evan@wvdii.org. That's my direct email. And you can find us on Facebook as well at Kanawha Communities That Care. And we love to invite you to our monthly Coalition meeting. It occurs the third Friday of each month at 10:30 a.m. We have a new location where we're meeting. It's at Hope for All, and that's in Charleston, West Virginia. You can find the exact address on our website and join the email list as well. So again, reach out to me at evan@wvdii.org, and we'd love to welcome you there. Again, a coalition is it's a collaborative culture that welcomes everyone at the table, whether you're working in the field or you're just a parent that's passionate about creating positive change in your own kid's school or your own neighborhood. We want to have you at the table.
And we've had everyone from folks involved with the public library, the Boys and Girls Club, scouting organizations come to the meeting, law enforcement, EMS, educators, parents, and youth, are also involved. So it's a great opportunity to give back to your community. And I know that you're working on issues specific to, substance use disorder and opioids, but also alcohol, also vaping, which is unfortunately a crisis among some of our young people because it's perceived safer than cigarettes in some regards. So there's a lot of work to do with the coalition over the next year. Where do you hope to be in 6 months from now? If I were to interview you again in 6 months, where would you hope we'd be?
On a sunny beach in Sarasota, Florida. No, I'm kidding.
Well, I figure you and your family would be paddleboarding.
That is a passion for us, but I just want to be surrounded by a group of empowered community members. They're equipped and ready to handle hard conversations with their own family within their household. And when we invite the community to come out to our coalition meetings, we can help deliver world-class training to these individuals. And that's in almost all cases, that's all free. And we just want to make that available. And we just want to, in 6 months, hope to see even more resilient West Virginia and Kanawha County in our schools. We want to invite teachers to come. We want to advocate on behalf of them and help them avoid compassion fatigue. We clearly, statistically, but in a heartfelt and authentically, we want to see a decrease in first use of substances or delay first use of substances completely.
That's great. Well, we're running out of time.
Okay.
But I am going to invite all of you, especially those of you in Kanawha County, to get involved with the Kanawha Communities That Care and attend the meetings. The community is only as strong as the people that are in it. And so I know that Evan welcomes all of you to join in those conversations. I want to thank Evan and the coalition as well as the DII team for all the work they do each and every day on youth prevention. We appreciate you being with us today and hope you have a great day.